Okay, so the next antiviral drug we should be discussing is what is known as what? The Baloxavir marboxil. Okay, so it's usually nicknamed what? Xofluza. Okay, let's call the name again. Baloxavir marboxil. So you heard a lot of names of drugs, the ones that you never knew that they existed. Okay, but yeah, for real, they're actually there. So the Baloxavir marboxil is actually a novel antiviral drug. It's used for the treatment of what? Influenza A and influenza B. Okay, so it's a prodrug. So that means if we give it, it will be converted to active, components, right? Hey, Vent Entertainment. Hey, bro, what's up, bro? What's up? Okay, so let's quickly talk about the drug. Okay, so it actually belongs to the antiviral type of drugs. Okay, it belongs to the class of what? Cap-dependent endonuclease inhibitors. Okay, so what's their mechanism of action? Baloxavir marboxil, do you understand? Like, it to be converted into what? Baloxavir acid. That means, like, if you give it, it will be converted to the active, metabolite. So this will now inhibit a subunit of influenza virus polymerase. Okay, this will now prevent a process known as cap-snatching. That's a process where the virus hijack the host mRNA cap to initiate mRNA synthesis. Do you understand? So this will now inhibit replication, like it will stop how the virus is now making other copies of itself. Do you understand? So basically, so it will now reduce the virus from making other copies of itself. Do you understand? So it will reduce the viral load. So administration is oral, okay, single dose. Absorption is rapidly absorbed. Distribution highly protein bound. Metabolism, yeah, of course, it will be the Baloxavir marboxil will be converted to Baloxavir acid. Okay, so excretion is mainly through the feces. Okay, so pharmacodynamics. Well, once you give it and it's actually being able to what? Reduce the viral load. It will reduce the viral load. Okay, it's effective against influenza A and B. Shortens duration of symptoms because it is reducing how the virus is making other copies of itself. So what are the different disease conditions I can use this drug to treat? Influenza infections. Okay, of course, we have been listing it so many times. So adverse effect is diarrhea, bronchitis, nausea, headache. Okay, then sometimes, rarely, you have hypersensitivity reactions. Okay, so I think